So I found out that I was pregnant and didn't have insurance at the time. It's just been such a great resource, and I've been so thankful that LifeLong is here. And the people here were really reassuring. There were consistent tests done and protocols that they had in place, and then a centering pregnancy group, it's called, where other women who are pregnant come, and we had appointments at the same time. So you also got a community too. And right now I'm going to what's now called centering parenting, and it's the same people from that group, so it's a community too, you know?
Hello, I'm Belva Davis. No one should go without health care. No one. Yet every day, thousands of ordinary people, through no fault of their own, fall through the cracks. They can't afford medical care, while politicians and corporations are still trying to figure out how to solve the problem. Some dedicated healthcare professionals have been doing something about it for over 30 years. They're called LifeLong Medical Care.
The health of my daughters is very important too. This way they can grow up, healthy, and then they can be able to do anything they want in life.
I like about my doctor's LifeLong is that he's very kind. He goes with me in every step. He takes care of me. He tells me if I'm healthy or not. He's very kind.
LifeLong Medical Care was founded in 1976 by the Berkeley Gray Panthers to serve low-income older people. But in the mid-90s, it became a full range of services for moms and kids, adults, older people. LifeLong serves more than 40,000 patients per year. They come from Alameda County, but they also come from Contra Costa and Marin as well. LifeLong offers a variety of services, including medical services, of course, that's primary physician care, but also dental services, mental health services. For people who are homeless, we try to make sure that they are placed in housing, because often for a homeless person, housing is the first health intervention we can make. At LifeLong, we believe in working with people to set healthy habits that are going to last them for a lifetime.
I think on campus we've seen a big need for students to eat a little healthier. They love eating unhealthy food, but oftentimes it's been expressed that it's because they don't have healthier options. So in the garden we cook with them and we allow them to garden and kind of rebuild this relationship that they have with their food.
How does OBUGS, Oakland-based Urban Gardens and LifeLong, how does that fit together? It makes sure that kids who've never seen a garden before had the ability to, number one, grow and then eat their vegetables from the garden. So they were very excited, and it was just an extension of who we are as an organization.
I'm a pill wellness champion. The wellness center is almost like everything that we do. It's like a place to be. It's like a safe place, a fun place. You can talk to anybody. They always be nice to you. You can go do your homework in there. You can almost do anything in there. And like they always give you the support that you really need. That's what I like, and that's why it's important to have them.
What we want to do here is try to make school the one-stop shop for these students. So when they come to school, not only are they getting an education, but we're also able to address their healthcare needs, whether it be first aid, whether it be supervision for chronic illnesses, or just to make sure that if they're coming to school and they're not feeling well, we can address that so that they are not missing days of school.
To be a peer wellness champion, it means to help West Oakland Middle School stay healthy physically and emotionally.
My name is Jesse Mitchell. I'm a retired Richmond firefighter, and I now am involved with the Health Promoter Program for LifeLong Medical Care. So the program is designed so that we go out into the neighborhoods and explain about health care services available at LifeLong. I love helping people, so this is a good job for me.
Sunshine my only sunshine. You make me happy when skies are gray.
We realized that Dad needed additional support because he was much more, having much more difficulty getting motivated to do things. We had been trying for some time during that time to get him engaged and get him involved in activities. And we learned about the center through the VA doctors who recommended that Dad get involved. Everything seemed to fall in place. All of a sudden, he started making connections.
For people like Joseph Fernandez, adult day health care is an absolutely critical service. What we're trying to do is work with people who have both complex medical problems and serious disabilities, often dementias, and keep them in the community and as healthy as they can be. The adult day health care really is a way to get people almost daily medical management and physical therapy type of help, which allows them to stay at home. It also makes a tremendous difference for their caregivers, family members often, who have to go to work during the day and have to live a life on their own. Without that kind of help, often people like Mr. Fernandez would have to go into a nursing home. We want them to be able to live out their life with really good quality of life, and we want them to be able to enjoy themselves day to day.
Just great that we could do this together. We're like a team, you know. I think it's nice that Dad is enjoying, and I get the benefit of just feeling good that he's taken care of and that he's got a place to go and he's got friends, you know. So this is a very important
Place.
Very important place, and I love you, Dad.
Thanks, Aunt. Thank you, LifeLong.
Hi, I really appreciate that you make this quilt for us. My baby is almost 9 months old. Her name is Chelsea.
What's it?
Chelsea.
Chelsea.
Chelsea, and she's a girl, and she loves the quilt.
So Ruth has, for years, very generously said, I don't know what to do with all these quilts I make. Do you think anyone could possibly use them? And you've just seen the stack of quilts that were given to the centering program at West Berkeley.
Makes me feel like it's all worthwhile. You know, I said it's something that I like to do, and if I can give it, you know, to somebody that appreciates it, well, that makes it all more worthwhile.
I think we both really like each other and appreciate our relationship with each other, so I've been fortunate that I get to do a few house calls. So even though we're, about 20 miles away, something like that, we're a distance from the over 60 site, I'll come down and see Ruth periodically and just have a visit like we are today.
I mean, I love her, and the care that she gives me and the person that she is herself. I'm really happy that I'm as lucky as I am to have people that care for me and make things worthwhile, life worthwhile.
As a child, I grew up very poor in the ghetto, in the barrio, with many needs that were unmet because we were too poor. And it absolutely touches me right down to my very soul that lifelong medical care is there to support people.
I'm not sure what I would do if I didn't go to LifeLong.
Gracias, LifeLong.
Thank you, LifeLong. Thank you, thank you.
Thank you, LifeLong.
Thank you, LifeLong.
Thank you, LifeLong.
Thank you.